Thank you. It's an honor to be here with my colleagues and with Protect Our Care New York. For me, I cannot imagine a greater betrayal of working people than the sheer ugliness of the so-called Big Beautiful Bill. I mean, it's going to cause 17 million Americans to lose their health care, including 1.5 million New Yorkers. It's going to cut Medicaid by $1 trillion and cause the state to lose $12 billion in funding for health care, for Medicaid and the Affordable Care Act and the Essential Plan. About half of the hospitals in New York receive about a quarter of their funding from Medicaid. So even if you're not among the 70 million Americans who directly receive Medicaid, you're certainly among the 330 million Americans who receive care from a hospital that receives funding from Medicaid. Like, there's a sense in which we're all on Medicaid. We're all affected by the unprecedented assault that Republicans are waging on one of the most important social safety net programs in the country. And to be clear, if Medicaid were a member of Congress, it would be the most popular member of Congress. It has more than 70% approval among Republicans, more than 80% among independents, more than 90% among Democrats. It is second and third only to Social Security and Medicare. It is one of the most effective programs that we have, and it's not only health insurance for the lowest income, it is long-term care. Like, Medicaid has become every bit as vital to our senior citizens as Medicare, because most, assisted living facilities, most nursing homes, most home care depends on Medicaid. And for me, this is not an abstraction, it's deeply personal. As a kid, I spent most of my life at home, at school, and in the emergency room because I had a repeat cycle of asthma attacks, and I would not have gotten the care that I needed had it not been for Medicaid. My grandmother was a victim of elder abuse. She would have continued to be a victim of elder abuse were it not for her Medicaid-funded home care worker who allowed her to age with dignity. I have a constituent named Jose who became a paraplegic in his teenage years. His mother was dying from cancer. And he said to me, he would not be alive today. He never would have been able to put himself through college and build his family were it not for Medicaid. And I spoke to another New Yorker, Phyllis, who said that she had to exhaust her retirement fund and sell her home in order to afford specialized care for her son who has severe autism. And when he finally received Medicaid, it was a game changer. And without Medicaid, she would have had to pay $16,000 a month. I'm not aware of a working person in the state of New York or anywhere in America who could afford $16,000 a month to provide their child with specialized care. And so for me, there's no greater value that we as Democrats can stand for than defending Medicaid. I think as a society, we are judged by how we treat the most vulnerable among us. And Medicaid is a program that benefits the vulnerable. And what I find more offensive than the legislation itself is the lie that Republicans are telling. Republicans would have you believe they're only targeting fraud, waste, and abuse. If you're only targeting fraud, waste, and abuse, why would it be necessary to set up a $50 billion fund to stabilize hospitals in rural America? Right? If you're only targeting the 29-year-old who's playing video games in his couch, why would you need to set up a $50 billion stabilization fund? The majority of Medicaid dollars here in New York are spent on the elderly and the disabled. The supermajority of those dollars are spent on the elderly, the disabled, and children. And almost all the dollars are spent on the elderly, the disabled, children, and working adults. Like, the notion that there are masses of welfare kings and queens who are gaming the system is a figment of the right-wing imagination. If there were ever a program that exists to lift up the most vulnerable among us, it is Medicaid. It is worth defending. And the decent among us have to win back control of the House and have to reverse these devastating cuts. There is no federal substitute for the kind of federal funding that we're about to lose. We need to win back the House, and we need to restore Medicaid as a safety net for the most vulnerable New Yorkers.